My name's Lucy Payne and I'm a palliative medicine consultant and I work at the North London Hospice. It's never easy to talk to somebody about dying, but it's definitely something that you can gain skills in and gain confidence in over time. When conversations are potentially upsetting, there are certain things you can do that make that easier. In the context of palliative care and specialist palliative care, it's probably easier than in some other settings because when I meet people, they already know they have a life-limiting illness and they usually know they're quite close to the end of their life. I find that people who are ill generally have quite a good awareness of themselves and of their health. And what I find makes it much easier for both parties is actually to explore with them their own perception of their health, how they think things are going and what they think the future is likely to hold. And almost always they're correct. So I don't have to tell them very much at all. And I can usually just agree with them and say that I share their worries and maybe give them a bit more depth. People notice when you're not being completely truthful and trying to hide something from them. And they won't always have the confidence to unpick that and ask you more about it. I think the key to all of that is to ask people what they want to know, how much they want to know, how honest they want you to be with them. And then that guides you. And if somebody says, I'm really afraid, I don't want to know anything bad, I just want to focus on today, that's totally fine. If they say, I think I'm really ill and I think I'm going to die in the next few weeks, and do you think that's right? You know, it's much easier. So I think as long as you've asked somebody what they want to know and how honest you want them to be, you can't go that far wrong. What I observe is that the loved ones of people who are dying find the whole process much more upsetting than the person who's dying themselves. And those conversations, therefore, are usually, not always, but usually less distressing with the person who's dying. So the big difference between palliative care and other medical specialties is, of course, we know that our patients have an incurable illness and probably have a relatively short time to live. Every day counts, and the way in which they want to spend that time and the things that feel important to them are different. It's not for me to decide what matters for my patients. I have to ask them, and I can't guess. So those conversations about what are priorities, how can I help them, where do they want to be cared for, are really important. There are obstacles to having good quality conversations. I think every person involved in those conversations has a role to play and can cause obstacles or make the conversations easier. Starting with the professionals, definitely some people lack confidence and feel anxious about having the conversations. And something many people seem to worry about is taking away hope. I think this affects professionals and often loved ones of people who are dying. They worry that if they tell the truth and say that time is short, that person might lose hope and then will have a worse quality of life or might die sooner. And that can be really difficult. In my experience and from talking to people who are living with incurable illness, actually giving false hope is much worse. If you give false hope, they might not have the opportunity to have that important conversation with someone or make plans they wanted to make. They might not do things they wanted to do because they didn't know that time was short. Sometimes professionals feel anxious about taking away hope and therefore try to be optimistic, which isn't always helpful in the long run. I think sometimes loved ones can try to inhibit those conversations. It's not unusual that loved ones say to me, please don't tell the truth. So in that situation, it's really important to try and separate people out so I can understand the different needs people have and the needs of the person who's dying compared to their family who might want to know different information. And then, of course, some people don't want to have the conversation. And that's fine. I always try to explain, usually we'll be making some sort of decision about the future or plans for the future, and they need information to make those plans. So I try to balance it by asking, explaining what information might help them to make a decision, and then it's up to them if they want that information or not. So people often worry about what it might be like to die and how they will feel in the days or weeks before their death and at the moment of death, and what symptoms they might get, who's going to care for them, will they be comfortable? And then the other thing people worry about is after death, and it not so much in the spiritual sense, although obviously that's a worry, but actually what mostly seems to worry people is what will happen to their family. Often practical things. What will happen to their house, to their property? Who's going to look after their cat? So usually once you start unpicking what are you actually specifically worried about dying, usually the majority of it are actually quite practical things that I can help with. Depending on the conversation you're having, the language you use can vary. I think if you need to tell somebody a very clear message, like perhaps somebody has died or you think they're going to die in the next day or so, then it's important to use that word because you don't want any uncertainty. If you're comforting someone, I think it's okay to use more gentle language and use the words that they use. People often avoid conversations about death and dying. And when people who are living with incurable illness start expressing worries for the future or mention the fact they might be dying, I see people, both professionals and their friends and family, trying to avoid that conversation and reassuring them, saying things like, oh, but let's focus on, you're doing so well at the moment, or let's focus on the good things. And I feel that really disempowers the person who's trying to express something. They want to explore those worries. And actually, if you explore them, you might be able to allay their fears. You might be able to make them feel better. But all too often, people avoid the conversation and don't take those cues. So I'd really hope that Dying Matters Awareness Week will help people to take those opportunities to dive into a conversation and not just skirt around it. Often people seem to worry about causing sadness. And the truth is, if you're living with incurable illness or someone you love is living with incurable illness, you feel sad all the time. So talking about it doesn't cause that. It might show it, which can be uncomfortable to the person they're talking to. But you're not going to cause that feeling. During somebody's journey with incurable illness, they usually have multiple conversations at different stages about what the future's likely to hold. And there isn't necessarily one big conversation of you are dying now. And there's usually being told that you have an incurable illness. And then at some point there'll be conversations perhaps about treatment stopping and that there's nothing further we can do to prolong life from this condition. Then there might be conversations about time is now shorter. And then eventually there'll be conversations about, perhaps it's the last days. And those conversations particularly will be guided by what people want to know. So it's not as intimidating as it might seem, because actually you can do these conversations gradually over a period of time. You don't necessarily have to have one big discussion about everything. When people ask me about what the future's likely to hold, I always have to caveat it and say I can't be sure. But I can say roughly, and we can usually work through together and figure out together some idea of what the future's likely to hold. The way that I deal with that uncertainty and try to support people through the uncertainty is by reassuring them that we'll be there with them, we're going to be caring for them, we're going to be addressing their symptoms and any problems they have, and really just that we're there by their side, supporting them through that, and that we understand it's difficult. Talking honestly is the best way to help someone live the last part of their life on their own terms. So that's why the way we talk about dying matters.